Hi, everyone. Thank you for joining us for another amazing topic of conversation. I want to thank my sponsors, the Health Channel, and please subscribe to their newsletter so you can stay up to date with the latest health trends, news, and much more. And to Finkelman's for the chef in you, with everything that you need to do amazing dishes. From the power of the heels, remember we're back live, and every month we have our networking event. The next one is January 12th at the AC Hotel. So please go to our website to sign up. And now I want to introduce you to Dr. Tessa Krantz. Welcome.
Thank you.
And we're going to have a very interesting conversation on, she is an help me pronounce this.
Urogynecologist.
Urogynecologist. So
yeah.
I'm envisioning that this is a mix between urology and a gynecologist, right?
Exactly, yes.
So please tell me, because this is the first that I've heard, that there is like a combination between both specialties.
Yeah, I think what happens a lot is either a urologist will see a patient for a bladder condition, or a gynecologist will see a patient for a gynecologic condition, and then a lot of times things are missed because there's a lot of interlap between the two. And so what this field does is combine them together. So I did my obstetrics and gynecology training, and then afterwards, residency, I did additional training just in this for 3 more years. And what this really does is work on conditions of the pelvic floor. So the pelvic floor is like a bowl of muscles, ligaments that all protect. And inside we have the bladder, and then the vagina and the rectum. And they all are in the same bowl of the pelvic floor muscles. And so a lot of conditions work and interplay with all of them. And so what I do is just specialize and focus on all of these conditions.
So let me ask you something. Like, for example, what would be something that a woman will reach out to you?
Yeah. So as far as the bladder issues are concerned, I treat a lot of urinary tract infections. I have a lot of patients who continue to get repeat urinary tract infections. Those are the type of people who are sent my way. Also for any urinary issues like urgency, feeling like you have to go to the bathroom all the time, leaking of urine, leakage with laughing, coughing, sneezing, urinary hesitancy where you feel like you have to go, and nothing's really coming out. And then as far as the vaginal tissue, like sometimes there's weakness of the tissue and you can feel a bulge or feel like something's coming out below. In addition to that, any pain with intercourse, vaginal dryness, any issues of pain with sex, sexual health, and then also any issues for the rectum, like sometimes people have pain or also leakage of stool as well. So in a nutshell.
In a nutshell, yeah. So let me ask you something. Is the myth of urinary tract infections linked with stress? Is it a myth or is it a reality?
I would not say urinary tract infections themselves are linked with stress, but what I treat and focus a lot of my practice on is treating what's called interstitial cystitis or bladder pain syndrome. And what I find is that is highly related to stress. And so a lot of my patients think they have urinary tract infections and they don't actually have them. But a lot of times stress can cause bladder pain and symptoms that seem very similar to urinary tract infection.
So it is related.
Yeah, in the sense that bladder pain, urgency symptoms are very much related to stress. So.
Oh, wow.
Yeah.
So there's a lot of people, and here I'm going again with a myth. that the famous headache excuse for women
Hmm.
when they are having intercourse, can this be related to like pain, pelvic pain, and that they literally think, okay, it hurts, I don't want to do it, but if it is a condition?
Yes. So pelvic pain is another thing I specialize in, and it definitely is related. I think a lot of patients that I see have suffered for years of having pain with sex and are just told to suck it up or to have a glass of wine when there's actually many conditions and many things that could be causing the pain. And really, what I do is try to tease out the cause and have people to stop having pain when they have intercourse.
So what can be the cause of the pain?
Mhm. So the most common thing I see is related to menopause and vaginal dryness. That could be related. Also, after having a child in postpartum, that can cause vaginal dryness too. And then even sometimes there's scar tissue that can be formed from having the childbirth or having a tear that can cause pain afterwards, and that's commonly seen. There could be lack of lubrication. There's also conditions, one of them is called vaginismus, where just the thought, like the anxiety or thought of having sex causes the muscles to tighten up. Sometimes they have that also, like with tampons. There could be pain for the vulvar area that can be sensitized, that can cause pain. And then commonly what I see too is where the pelvic floor muscles get tightened. So kind of like when we have a shoulder injury and those muscles tighten up and spasm, if we don't relax them out, they'll stay tightened and hurt. And that is commonly seen for the pelvic floor muscles too. They can tighten up and cause a lot of pain and discomfort. And sometimes that's seen with sex, sometimes that's seen with urinary issues too. So sometimes they can be related.
So that can also be the pain that first time having sex can be related to,
Yeah.
because the nerves can contract because of nerves.
Yeah, sometimes the muscles tighten up from the nerves, and then that can cause pain. And the thing too is if it's not identified or if someone's suffering for years and doesn't get help, it continues to get worse instead of better. Um,
So, when I was growing up,
mhm.
like still sex was a taboo.
Yeah.
But now girls are having sex at a younger and younger age.
Hmm.
Is there something that you want to tell the parents on how to talk to their, especially their daughters or also their sons?
Yeah. I think it's important, either if the parent or if they don't feel comfortable to have them to see a gynecologist, or I think even a urogynecologist is a great place to start, because there's a lot to know about like sexually transmitted infections, a lot to understand about the anatomy that's kind of ignored and no one talks about, and then also about contraception. I think bringing up the topic of contraception options available out there is something for people to know because kids are having intercourse at a younger age, and it's good for them to know that information before moving forward and having sex.
What about the contraception and talking about it with everything that's going on
Hmm.
with the laws and everything about not only abortion, but it's not only about abortion, but it also deals with contraception and women's health.
Yeah, I think it's even more important now to talk about contraception because there's not as much access to care as there was previously. And now we need to really protect our children more than ever with proper contraception because if they aren't, educated and have that awareness of the different options out there and aren't using them, there's just really not the access there used to be. So, which is very
So it's
difficult
more
for
about
patients.
educating them.
Yeah, and I think education is extremely important for even before this, but especially now to know because there are so many different options out there for contraception too that they can use.
But they need permission of their parents.
Yeah, and I
And
think
some
that's
of them are
important to
not even
look.
talking to their parents about this.
Yeah, and that's where I think it's always helpful to have a provider or gynecologist to talk to as well, because for these, if it's something that you don't feel comfortable talking to, it's something we do every day and would be very comfortable kind of going over all these things in an environment where the child feels comfortable going over it and can talk about their sex life more involved than maybe they would with their parents.
Is there any relationship with starting sex very, very early to the pain that you're talking about?
I would say there really isn't a relationship to how early it is with the pain. There could be many times in the life that can cause pain with sex. I have even from ranges from teenage years to, as I have a 90-year-old patient who is having pain with intercourse that just started to have it. So
And at 90?
Yeah.
And she's active?
Yeah, she's active. So you never know. There's always different points in life that can cause pain. I think the most important thing is to find help when it does happen, because otherwise it'll just become a cycle where the pain just continues to happen and could worsen.
No, and especially when it's another myth that it hurts, so suck it up. And
exactly. And I think the difficult thing is even a lot of providers say that to patients because they just don't know. And they think that's the only option they have out there. So it's really about people also kind of doing their own research and being an advocate for themselves, because what I find is, people listen to it. If their doctor says that's it, you need to have a
it
glass of
hurts
wine.
and that's it.
That's it. They're not going to bring it up again. They're scared to talk about it, and then they're just suffering for years.
Is there a special treatment, or there's several treatments that you look for?
There's many different treatments I do. It can range based on the cause. Especially for vaginal dryness, there's different creams, or vaginal estrogen cream works really well. It also prevents urinary tract infections. And that's kind of how things are related more than you really realize. But besides that, I do different medications. I even do shots to the pelvic floor to help for pain. So for my patients who have muscles that are tightened, there's trigger point injections you can do to help relax the muscles. I even do vaginal Botox injections for some patients where the muscles are tightened, and that works great too. And then I always do a more holistic approach first. So always try to do the things that are the least invasive that can help. Pelvic floor therapy is a great place to start as well. But it depends on the cause, because for example, for vaginal dryness, cream and lubricant usually do the trick.
And what about men? You don't deal a lot with, you concentrate specifically on women.
Yes, yeah. I've been tried a few times to treat some men, but I do not. I only treat the females. So, yeah. I think
No,
unfortunately
that's really interesting, because I think there's a lot of people that, like you say, that they don't even go and they don't know what's out there.
Mhm,
And now
yeah.
with everything that's happened,
Mhm.
things are opening more and you really need to look for alternatives.
Yeah, and a lot of the some providers, for example, just talk straight about going to surgery, and there's a lot of natural different treatments that work great for treating pelvic pain and intercourse. And it's really about treating each person as an individual, identifying the cause, and really figuring out how to help them the best way possible.
Have you seen an increase in young girls with sexually transmitted diseases?
I haven't lately, but I think overall just sexually transmitted infections are a lot higher than we realize. I think in younger patients, they don't really know about sexually transmitted infections as much. Um, and oddly, I see it increase as well in the elderly population. And
Really?
yeah. And I think it's because in that population, they think, well, I can't get pregnant anymore, so it's okay. And so I've actually seen in that population the sexually transmitted infections raise as well. So just something to always be thinking about and concerned about.
So that's interesting. So
Yeah,
yeah, because they think that it's only about protecting themselves from getting pregnant
yeah,
and not
yeah.
sexually transmitted infections.
Yes. So you can still get them at any age. So it's something to always think about.
Is there a message or something that you want to tell uh, the people that are listening, the women, moms, especially on how to talk to their daughters? A special message
About sexually transmitted infections.
about what you do.
Oh, what I do. Yeah. So I would say the most important thing is just if you have anything that you're concerned about and aren't getting the help you need from uh, whatever providers or people you have in your life. And the most important thing is what you have is real. The pain is real. And there are people out there that can help you. Really, we want to break the stigma that these aren't things that are taboo not to talk about anymore. There's people that, like, I do this for a living, and I want to talk to as many people as possible to help them with their conditions. And pain is real. If you're not getting the help you need, there's people out there that can help you, and we want to help you get better.
No, that is the main reason that I wanted to bring you as a guest, because there is, like you said, a stigma that women don't
Mhm.
talk,
Yeah,
or they sometimes they talk to each other, but they feel that it's something they cannot talk about.
yeah,
So at
I,
least now they know that the pain is real, that they can get some help. And where can they find you?
yeah. So I have an office in Aventura. It's
Oh,
mhm,
okay.
yeah. And so I'm in the Miami Skin Doctor office. I have my own private office there. I also do telehealth and I do home visits as well. So if anyone feels uncomfortable in an office environment, they can get care at their home as well. So
So, Dr. Krantz, thank you so much.
thank you.
This was very informative. And for all those that really, if you need help, now you know who to go to.
Yeah,
And to everyone, please stay safe. And until next week, thank you so much.
thank you.
Have a wonderful day.